this screencast, we're going to talk about the chambers and valves contained within the heart. Before we talk about that, we need a quick reminder that when we're looking at an anterior view of the heart, the left side of the heart is on the right side of the diagram, and the right side of the heart is on the left side of the diagram. Besides being told that it is an anterior view, we can see that this apex always points to the left, and therefore we know that this left side is over here because we're looking at an anterior view. One other trick that will tell you as I move on is that the left side of the heart has a much thicker myocardium, and so that's another way to tell which is the left side of the heart, especially if you're actually holding a heart, like when you do a dissection. So the heart is divided into 4 chambers or little rooms, holes, openings. That you have 2 atria and you have 2 ventricles, one on the left and one on the right. Another thing you'll notice about diagrams of the heart is they're often colored blue on the right side to symbolize that the blood is deoxygenated, and red on the left side to symbolize that the blood is oxygenated. So first we'll talk about the atria. Atria is the plural form of atrium. So you have the right atrium and the left atrium. These are the upper or more superior chambers of the heart. They receive the blood that comes back to the heart, and they have very, very thin walls. Remember that most of the heart wall is made up of muscle, and so the atria are only pumping blood into the ventricles, so it doesn't need to go very far, and most of the time it's assisted by gravity if you're standing upright. The ventricles are the lower chambers of the heart. They're much bigger than the atria, and they're going to take the blood that they get from the atria and then pump that blood into arteries leading away from the heart to go wherever they need to go. The left ventricle walls, as I mentioned before, are very, very thick, and they're a lot thicker in comparison to the right side of the ventricle. The septum is the separation between the right and left sides of the heart. So you can see here, this is the septum. It has a portion up here called the atrial septum that separates the atria, and then the portion down here called the ventricular portion of the septum, which separates the left and right ventricles. We can just call the whole thing the septum, but you may see it labeled separately in some diagrams. The blood in the left and right sides of the heart don't ever mix. It's much more efficient to keep blood wholly oxygenated on one side and much less oxygenated on the right side of the heart. An exception would be if there is a defect, and this defect is called a hole in the heart, and a lot of babies are born with this. You will usually close up on its own, or it can be surgically closed up so that we get nice, efficient blood flow. So that's the border or the separation between the right and left halves of the heart. But we also need to separate the atria from the ventricles. This is done by AV valves. AV stands for atrioventricular. And what these valves do is they make sure that blood only flows in one direction from the atria to the ventricles as the heart is squeezed. You have one AV valve on the left side of the heart and one on the right side of the heart. When we look at diagrams like this, we'll see that they look like little flaps. However, when you look at a different view of the diagram, of the heart, this is a superior view, you can see that they're actually kind of like almost a little parachute or funnel that's been cut, and so it's a nice little door. And it really does go all the way across. It's not just the flap that it looks like from the side view. The tricuspid valve has 3 cusps, hence the name tricuspid, and it's on the right side of the heart. The bicuspid valve has 2 cusps. It's also called the mitral valve, and it is on the left side of the heart. So how do these valves actually work? What they do is they prevent blood from flowing backwards from the ventricles into the atria once the blood has been pumped into the ventricles. We don't want it going backwards because that's inefficient. So you have these little strings that are called the chordae tendineae, and what they do is they attach these valves to these muscles down here called papillary muscles. The papillary muscles are going to pull on the chordae tendineae, which then pulls on the valve to keep it closed as the ventricles contract. So there you have the right and left sides of the heart, the 4 chambers of the heart, and the valves that are contained within the heart itself.